Hello everyone, I am Dr. Soundarya, consultant urologist. I am working at Preeti Urology and Kidney Hospital, Hyderabad since the past 6 years. So, I would like to tell about a common problem, especially which happens in pregnant females. In pregnancy, whenever the lady undergoes an ultrasound scan, sometimes swelling of the child's kidney is seen in the scan. So, many people come to us getting panicked that so even in the pregnant stage, even in such a small baby inside the mother's womb, the baby's kidneys are swollen. So should we terminate the pregnancy or is it a danger? So there are so many doubts and anxiety which happens among the parents and also the family. So it's not a matter to be worried about. All are not one and the same. So easily treatable conditions are there. Like even if the kids have, that is the fetus, I mean to say the baby which is formed inside the uterus, if that baby has any swelling of the kidney, no need to worry is the first message. What is the learning we have to understand is that there are various methods to treat the child, and therefore what we have to do is to consult a urologist first. What we do is we see the child scan, the mother scan. We have to serially follow up the scan in the first go, measure the level of swelling which happens in the kidneys, and also we should measure the amount of water, that is the water inside the uterus. We call it liquor. So whether it is adequate or not, the baby's growth, whether it is adequate or not, and whether the swelling keeps increasing or not. Many times, at least 70% of the times, once the child is born and once the child grows up, these swellings disappear. So no need to worry and no need to think of termination of pregnancy and all in the first go. So after delivery, until delivery, the scan has to be done serially, and after delivery, please consult a urologist and get the tests done by the urologist. That is, the first thing is to be done is the ultrasound scan. That will give an idea about whether the swelling of the kidney is one side or two sides, whether it is mild or severe, any problem with the bladder and all that we'll get to know. With this initial information, some children may require additional tests like MCUG test, that is an X-ray which is done commonly, and also a functional study, that is the kidneys, how much they are functioning. So based on this, there are a lot of treatments available and easily treatable. Some kids may simply be treated by just medicines. Some kids with just by the growth of the child, the swelling may disappear. All you have to do is to come for a regular checkup. Some kids may get mild infections or fever, so they may be treated with medicines for the first time. For some time, if the medicines do not work, then they may require corrective surgery, that is not open surgery. It can be done by advanced laparoscopic or robotic technology. On simple surgery, the child gets cured for a lifetime. So it could be a block in the urine pipe, or it could be a reverse flow of urine from the bladder to the kidney. So these are some conditions which can be easily treatable. So by nowadays the technology is advanced. Just by keyhole surgery, no need to open the child or no need to put big scar or big stitches will not come. Just by keyhole surgery, even both the sides can be treated at a time. So that is the advancement of technology nowadays. So laparoscopy and robotics have come a big way, and these kids can be treated and they are cured for a lifetime. So whatever the situation be, suppose certain kids who have some conditions which cannot be treated by surgery, they also can be kept on follow-up, regular follow-up. A multidisciplinary team will involve, like both the urologist and nephrologist will treat the child together, give a better quality of life to the child. So, friends, if any pregnant female is coming to us with ultrasound showing the kidney of the child is swollen, first thing, don't panic. What please meet a urologist. And what we will do is, we'll do a regular checkup scan of the mother and the child, and based on the child's reports, after delivery, again the scan will be continued. Based on the scan reports, some additional tests may be needed to confirm the diagnosis, because always ultrasound itself cannot give the entire diagnosis. The two common problems that we see are, one is block of the urine pipe and swelling of the kidney, another is reverse flow of urine from the bladder to the kidney. So these are all easily treatable by surgery. Nowadays it is advanced laparoscopy or robotic technology, and with that the child gets cured for lifetime. In rare 2 to 3% of the cases, it may not be treated by surgery, but then yes, we can give a better quality of life to the child by involving a multidisciplinary nephrologist. Thank you.